That was all about health care reform. Marco Rubio mocking Trump's health care plan. Now, Trump wants to increase competition by allowing insurers to sell plans, any plan they like, across state lines without regard to a state's own insurance regulations. That's called the free market. Fox Medical A-Team's Dr. Marc Siegel is with me. Sounds like a great plan. Free competition, national insurance companies offer any plan you like, buy whatever you want. What's wrong with that?
It's great, and sometimes Trump uses a verbal shorthand that gets him in trouble. The lines. It sounds like the lines in a doctor's office. He means state lines. He means if you have a health plan in Nevada, you should be able to bring it into New York. That will install national competition. It will drive down premiums. There's essentially a statewide monopoly in each state because you can't do that. All three of them agree with that. It's huge. It has to be in there.
Got it. Now, Trump is also talking about negotiating for Medicare drugs. I mean, these blockbuster drugs. He would negotiate the price down. That's what he says. Is that a good idea?
Hugely important idea. I'm for that. It's controversial, Stuart, but listen, we talk on the show all the time about how expensive new cancer drugs are, new heart disease drugs. Medicare sets the standard. The rest of the insurance companies go along with it. If Medicare could negotiate, you might not see some of the news stories we have here. Some wild guy taking advantage of a poor dying patient with a cancer drug on Medicare. You know,
so you like that aspect?
I like that a lot too.
Okay, last one. He wants to get now. Some of Rubio and Cruz say no mandate. In other words, the government can't say you gotta have this coverage. Now, where's Trump on that?
Well, and they're playing gotcha football with that, but also CNN nailed him on that. I don't want to repeal the individual mandate. Well, you have to get rid of the mandate if you're going to get rid of Obamacare. So he backtracked on Twitter the next day and said what he really means is he wants a backstop for pre-existing conditions. That's like what President Nixon had.
What's that mean? Wait a minute. What's that mean?
That the poor people have some kind of catastrophic coverage. Maybe they pay into it, maybe the government, but catastrophic, not like Medicaid. Medicaid is this bloated product, hugely expensive, narrow network of doctors. It doesn't work and it's too expensive. Replace Medicaid with something more scaled down. That's where that may go. If he's listening to us.
Amazing. 2 minutes. You got 3 subjects in. All good. Thank you, Doctor.
Great to see you, Steve.
Like it. Now, next case to the